Hi everyone, thank you for having us join your meeting today. I'm Kayla and this is Michaela beside me, our youth peer worker for SPIDER. We are very thankful to be involved in the SPIDER project and throughout this presentation you'll hear some great work that's been completed by Michaela and the Headspace team over the last 7 months. So what we will run through with you today, an overview of the peer worker role, integrating youth peer worker role into the Headspace model, what has been achieved and worked well, what some of the challenges or barriers have been, what are the gaps, and what are the opportunities for improvement and sustainability.
Hi everyone, I'm Michaela, the youth peer worker here at Headspace, and my role is funded by the Western Victorian PHN supporting people with intellectual disability to access healthcare, or the SPIDER project. And it aims to improve how primary healthcare services are delivered to meet the needs of people with an intellectual disability. My role in the project has involved working alongside the community and our Headspace team, including people with a lived experience of intellectual disability, as well as their families and carers, disability workers, service providers and advocates, practice nurse and staff, and a multidisciplinary team of mental health professionals. By working with all involved in delivering and receiving primary health services, we aim to improve our understanding of how we as a healthcare provider can better tailor and target those services for local needs.
So we have integrated Michaela's role into the Headspace model by having her within the community awareness and engagement team. So this is currently where we have another peer worker for family and friends, as well as myself with a health promotion background. Michaela is supervised by our operations manager alongside myself who oversees the project. Headspace operations manager oversees the following programs: community awareness and engagement team, work and study, the nurse-led clinic and admin staff. These are more the operational side of the Headspace model. So from here we have identified ways in which we can integrate Michaela into the clinical team. We have done this by having our peer workforce involved in clinical case review meetings, having our peer workforce attend clinical team meetings, presenting different SPIDER-related topics to the whole Headspace team, provide secondary consults to clinicians to improve individual client care, and co-facilitating with Headspace clinicians in group work sessions.
So some things that have been achieved while I've been in the role is delivering awareness sessions to young people with a disability to build their mental health literacy and advise them on how to access mental health services. So I've done that by working with some different group sessions, so Passport to Employment, the Merri River School, Achieve Southwest, and the Southwest TAFE Foundation Disability class. Delivering health and wellbeing activities to young people with a disability. I've done this by the Young Child Group here at Headspace and Brophy Open Day, the Work and Study Group and Headspace Day celebrations. I've been developing the following easy read mental health and wellbeing resources, internal documents for Headspace and Brophy, mental health and wellbeing resources, accessing Headspace services, alcohol and other drug resources, and inclusive healthcare resources. I've also been able to provide an on-site environmental scan of the Headspace community and youth building, as well as working with a small group of young people to complete an on-site orientation to provide further feedback from their point of view. I've also assisted people living with a disability to access a range of digital supports available to them through the work and study group, secondary consults, and supporting clients and young people with accessing support groups and further information. Building the capacity of Brophy staff by providing them with training opportunities to educate them further around working with young people with a disability. I've been able to do this by completing 7 clinician drop-in sessions, completing secondary consults with Headspace staff, presenting the youth peer worker role at the Brophy regional meeting, I've created a training register for all Headspace clinicians and created a library of resources for Headspace clinicians and staff to access at any time. Advocacy and engagement has been achieved by completing the Young Leaders program through YDAS, the involvement of Brophy's Diversity and Inclusion Working Group, the Moyne Shire Disability Access and Inclusion Meeting, a proposal for the sensory improvements in our consulting rooms, attending case review and clinical review meetings, and engaging with local stakeholders and fellow peers in the region. I've also completed the YDAS Access and Inclusion training and presented feedback for Headspace staff, as well as shadowing Headspace staff members as they complete their day-to-day tasks, and I provided feedback around what was inclusive and accessible and possible improvements to be made. Some challenges and barriers I have faced is there really isn't too many, as the team are very open and willing to make changes where appropriate. A possible challenge that has arose is possible funding for the sensory room changes, but the team will do their best to implement what they can. A small barrier personally I have is my health flare-up, so some days or weeks are worse than others and I can't work the full capacity of days. But the Headspace staff have been accommodating with organising my work hours and as well as organising a work from home day when needed. Some current gaps that we have prior to me commencing with Headspace, the GP had left, so we haven't been able to dive into this area properly. The team now has a remote GP organised to support Hannah, our practice nurse, and I have been able to work closely alongside the primary care team through this process. I've also been working with Hannah to make accessible resources and ensuring that the practice has a more inclusive space and being able before commencing services again.
So opportunities for improvements and sustainability. So we are always looking at ways in which we can improve our service and keep up with the ever-changing environments. Michaela is engaging with young people that we may not have engaged with before due to not being aware of or think Headspace is the correct service for them. She's implementing small changes within what we already offer and supporting Headspace to become a local service that is accessible and seamless for young people entering a health service, which is often complicated and overwhelming for young people living with an intellectual disability. Michaela is breaking down barriers and shows young people with an intellectual disability and their families that we are and can be the right service with her support. Michaela is making a huge impact within not just Headspace but also Brophy. She is a Headspace representative that is participating in the Diversity Inclusion Advocacy Group. Michaela is a young person living with a disability on the advocacy group. She will be supporting the lead agency to become more inclusive and accessible organisation for all. And that's all from us today. Thank you all for listening.
Thank you so much.